Okay, good afternoon, everybody. I think we'll get started. Just to introduce myself, my name is Aidan McCrory. I'm a Senior Improvement Advisor in the Care Inspectorate, and I have responsibility for leading on the winter preparedness suite of support that we're providing to the sector. I want to thank everybody for taking the time out of their afternoon in this extremely busy and absolutely unprecedented times. We're hoping today to, well, within 1 hour to try and hopefully add some benefit for you guys in terms of posting the guidance and support and various other resources that are available. We will be a number of speakers today. We'll just come on and introduce yourselves with the cameras on for a minute, and then we'll just revert back to your slides so we can move through those. So each speaker will come on and do that. Next slide, please. So this is a Teams live event. So this is slightly different from the normal Teams, where in normal Teams you can raise a hand, turn your video on, and come on and interact. But due to the numbers of people who have registered for these events, I think there's around 150 registered for today, that normal Teams just simply won't cope with that. So we've had to go with the Teams live event. So the main way of interacting with each other is through the Q&A function. And I really do encourage you to ask questions as we move through our slides on the Q&A function. Because we're going to take some time out in the middle of our slide set to review those questions and maybe address them for you, and at the end as well if we have time. But just to let you know that we will be sending out all the slides and all the questions that have been asked and all the answers to them in the day or two after today, after we get all those collated. So that's going to be something that we'll do in the next day or two. Next slide, please. So what are the COVID winter learning events? Well, in partnership with our scrutiny and assurance colleagues in the Care Inspectorate, and kind of making sure that we work in partnership and using our intelligence, we've targeted care homes and care at home sectors because they are the ones that, from that intelligence, are really crying out for some additional support. And we're seeing that through all our data sets, really, when it comes to inspections, complaints, notifications, or the safe staffing tool that you'd be familiar with now. All the data is coming through that these are the two sectors that really are crying out for some additional support. And we're starting to see some of the other sectors in social care starting to come to that place as well. But considering the pressures that these parts of the sector are under, we targeted our approach specifically for you guys. And it's a 3-level approach, and we'll talk a little bit about more of the 3-level approach in a minute. Next slide, please. So we're expecting, like I say, about 150 people have registered for today. So we're expecting around 100 people to be on this call just now. And our aims are very simple. We know from what people are telling us that there is and there has been significant confusion about the speed on which guidance comes out, the rapidly changing guidance, and the complexity that guidance that's in that guidance. So today we want to signpost people to some solutions to that, some of the Care Inspectorate solutions to that, and some of our speakers will talk about that in a bit more detail when we get into their slide sets. But it's also to say that, services may well be, completely on top of the guidance and the resources and the tools that are available to them. And if that is the case, then just please treat this as a refresher. And there might be something here that's new for you or supportive for you. But there's a significant amount of services out there that have had no scrutiny from us over the past, 6 months or so, because we're really targeting high-risk services and services that are in need. So there's a significant amount of services that we are in contact with, obviously, but we've had no scrutiny activity with those guys. So we think, we feel that signposting people to what's available out there really will bolster services' ability to cope in the winter period and beyond. And that brings me nicely to our next slide, which is a look at the whole system that we are delivering here from the improvement support team and the Care Inspectorate. So what we're doing today is the level 1 stuff, which is the signposting to resources and information sharing, and that's really our core function, and that's what our aims are all about. But we're going to move, and we'll talk about this at the end, into the next stage of that, which will be around key question 7 in our quality frameworks, which I'm sure you're familiar with, which is the question around COVID and preparedness for COVID. And we've developed a self-evaluation tool to support services to undertake that reflective practice out with any scrutiny activity, so that they can identify areas for improvement within their services and then start to address that and self-manage that process out with any contact from the care inspector or a regulator around that. And then the last thing that we propose to do will be, this will be in the new year, is really listen to the sector and answer and in terms of what more support that you guys need. So it may well be in, January, February, we're still talking about testing, we're still talking about visiting, we're still talking about PPE, or we could be talking about vaccination issues and things at that time. So what we're going to do is we're going to gather all that information over the next month or so, and really listen to what people are asking us, and then deliver another suite of webinars that really take a deep dive into some of those hot topics and really try to unpick some of that for people and answer some of those questions that people have. So you'll hear from me a little bit later on, just as we're finishing this up, and I'll give you some more detail about that. But for now, thank you very much for joining us, and I'd like to hand over to Craig Martin, who is the COVID team manager. Thank you.
Hi, thanks, Aidan. As Aidan said, my name is Craig Martin. I'm the team manager for the Care Inspectorate's COVID Flexible Response Team. We're a small team, a small multidisciplinary team from across our various directorates, from strategic inspection, scrutiny assurance and improvement support. And we were drawn together in March really to start looking at supporting the organisation around about interpretation of notifications, etc. And that sort of piece of work's quickly moved on and morphed into providing support to our operational staff and internal managers, etc. and the contact centre around interpretation and keeping up to date with guidance and sort of developing a sort of knowledge base around about the COVID guidance as it came out. Can we move to the first slide, please? Okay. Just to recap, those of you that haven't been subject to any sort of scrutiny activity this year so far, and those who have will be aware that we have developed Key Question 7. That was in response to the pandemic, and really it focuses on areas around about staffing and infection control and supporting the services to improve and work their way through some of the problems that they may well have encountered in relation to that. I suppose the emphasis and the thing that we really need to point out is that we are very much aware that many services will be fully up to date or have kept on top of this developing guidance and the rafts of guidance that have come out. However, I suppose the thing that we would really like to point out this time is that there's a concern around about the care homes who have not had an outbreak in the first sort of wave, and now that we're entering the second wave, we really want to make sure that services are prepared and are ready to deal with COVID-19 and how it might affect them. Can we move to the next slide, please? So as part of the scrutiny assurance activity, we've found that this highlighted these 4 sort of key areas and the top findings, and those were around IPC, infection prevention control, PPE practices, environmental sort of cleaning, how you cohort staff, the use of the space, and the restrictions that isolating people may have caused to staff and residents alike. Issues around about helping people stay in touch with friends and relatives, and a really major issue has been the effects of social isolation on individuals who receive care services and keeping well. Can we move to the next slide, please? I was going to say before we move on to the SIPs entirely, I mean, one of the big sort of key areas that have come up through the key findings have been those issues around isolation, which has included changes in people's sort of well-being, mental health, through medication management, eating and drinking, loss of access to exercise and outdoor space. Reduced mobility, effects that's had on tissue viability, muscle wastage. So there have been quite a lot of sort of issues flagged up about people's sort of physical health as well as their mental well-being. One of the major things that we would like to do is guide people to the relevant guidance to help support them as they work through the pandemic. And one of the major things that's come through has been the new National Infection Prevention Control Manual that's being developed. But in the meantime, we still have the original National Infection Prevention and Control Manual, and from that you will find the 10 SIPs, which are the standard infection prevention and control procedures. And it's vitally important that staff, all staff, that's whether it be ancillary care, catering staff, etc., must be aware of these procedures and how they apply to them. And also finally the fact that we have added an 11th SIP, which is maintaining social distancing. So it would be really helpful that services ensure that staff familiarise themselves with the Infection Prevention and Control Manual, that they're aware it's there, that they're aware of the SIPs and how that impacts on their work practices, and also to keep an eye out for the new Infection Prevention and Control Manual, which will be quite specific to care settings when that's published. Can we move on to the next slide, please? So as part of our response to the pandemic, we have developed a range of frequently asked questions and answers, which are available on our website, on our COVID landing page. This picks up on guidance, etc., as it changes. We've tried to make them thematic. They relate to the types of inquiries that we've received through our contact centre. So that's from members of staff, members of the public, through our own inspection teams, and the feedback that we receive from them. We've also developed a COVID compendium, and that contains up-to-date or hopefully up-to-date direction towards links to guidance that's service specific, and that's laid out in such a way that it sits under each service type. So if you go to our COVID landing page, you can click onto the COVID compendium and you can see a range of documents there that might relate to your staff. So for example, we have you will see, if you click on that, there will be links to infection control manuals. There will also be links to, for example, that the National Infection Control Manual Appendix 5 has been updated, and that's been updated to reflect changes in glove use. We frequently update we update our frequently asked questions every few weeks to keep on top of those. And whilst we do appreciate that to some extent this may be repetitive and we're covering the bases that we've covered before, we're still receiving sort of very basic inquiries around about the use of PPE. So it's sort of vitally important that people try and get up to speed with those changes, and our COVID compendium is probably an ideal place to start if you just want a one-stop shop where you can click into your service type and see what guidance is available. And I will give an example. We received an inquiry over the weekend around about the overuse of PPE and the use of gloves and aprons. So we were able to signpost people back and say, well, actually, if you look here, you'll see Appendix 5. It's available. It's been updated. It gives you quite clear guidance now on when you should not use gloves and in order to even save supplies, etc. Can we move on to the next slide, please? Right. Finally, I'm just going to cover the sort of facts message. We'll keep coming back to this, and my colleague Jackie Dennis will go through in much more detail some of the things that we've passed over. But the fax message, we would really like to sort of drive this home in your everyday working practice. It does apply to your workplace. When we're looking at face coverings, consider your masks. You've got the extended, if you go to the COVID compendium, you'll see that there will be links to, I think the most recent guidance is probably the extended use of face masks, which will explain to you in the circumstances in which masks should be worn. I'm quite sure that you will be aware of that, but you can go and have a look in more detail if you need to, if there's any doubts in that area. Avoiding crowded places. Again, this applies to you in your workplace, and your workplace is a home for residents, and what you do in your day-to-day activities, and avoiding crowded spaces, avoiding crowded common areas, common rooms when you go and take your lunch and breaks, that you keep yourself socially distanced. Hand hygiene is the other important part that we will press home, that it's not just about wearing gloves, it's not just about using alcohol rubs, that you know, the gold standard would be frequent hand washing and a good hand washing technique. Social distancing, keeping the 2 meters apart. It may be difficult in a care home setting to do that, but it's important to keep it in the back of your mind at all times that the one way that you can avoid the spread of the virus is to keep a distance from other people. And finally, the self-isolate and message. We are aware that care home staff are subject to regular testing at the moment. However, it's still vitally important to be aware and self-aware that if you have any symptoms at all, that you inform your manager, self-isolate and book a test. I'd like to pass on now to my colleague, Jackie Dennis, who's an Improvement Support Advisor, and she will go into some of the information in a little bit more depth.
Good afternoon, everybody. As Craig said, I'm Jackie Dennis. I'm an Improvement Advisor with the Improvement Support Team within the Care Inspectorate, but I've been deployed since April to the COVID Flexible Response Team, and I was placed in the lead of the PPE. So basically what happened was my role entailed working with NSS and the Scottish Government around the processes for access and distribution of PPE to the sector. So initially, obviously you can imagine my role was really busy, but to be fair, things have settled down now as the PPE supply and demand has settled down. So my role is now part of developing and responding to inquiries as part of the COVID Flexible Response Team. Next slide, please, David. So COVID in context, it's everything in context for me. So what I thought I'd start with is just to, I mean, you've probably done a lot of reading like myself and you've picked up loads of stuff about COVID, but every day is a school day. I'm picking up stuff every day in relation to COVID and how the virus spreads and how the virus, you know, can be contained. So there's lots of information out there, as Craig was saying earlier. One of the things that, again, that I always go to is statistics and data, because it helps to put things into context. So again, what we've done here, and when you get the slides, all these links are active, so you'll be able to go into the Scottish Government website or the Public Health website, and you'll be able to like download or look at what is happening within your local area where your care home is sitting. And one of the things that interests me is around, you know, if you've got a care home that doesn't have an outbreak, but you're in an area with a high transmission rate, so for instance the board area that you're in or the partnership that you're in, it'd be really good to hear, you know, to share that kind of experience, so as that, you know, we can all learn from each other and see what these care services are doing well that maybe others could pick up on to help them manage any COVID outbreak that they might have coming up in the future. And like Craig said earlier, we're picking up now that a lot of care homes that missed or were fortunate enough not to have a COVID outbreak in the first wave are now experiencing that during this second outbreak. So again, it's really important for everybody to use this kind of data to help them look at what's going on around about them, so that they can start to ask questions. If you look at that wee picture, that's what COVID looks like under the microscope. And if you've done any reading, it's basically surrounded by a little fatty layer. And the reason that the government is pushing hand washing is the fact that the COVID fatty layer is broken down by the use of detergent. And that that is basically what kills the virus. So good cleaning and good hand hygiene are absolutely key to reducing the transmission and spread of this virus. We also know that from the research that obviously the older you get, you're immunocompromised, and you're probably more likely to pick the bug up. So again, if you're unfortunate enough to have an outbreak within your service, it's really important that you get, if you reinforce the facts message through everything that you do, in order to reduce the risk, obviously, at the minute. And if you do happen to be unfortunate enough to get an outbreak, then obviously your wraparound teams will come in and support you to do that. But there's a fantastic document on the HPS website. There's an outbreak checklist there that you could have ready just to be on the safe side, and it actually takes you through step by step what you need to do. If you look at the figures there, you can see I kind of track the ups and the downs. So that's a really positive thing that's happening at the minute. That there's new cases are coming down, there's less people in intensive care than there was last week, less people in hospital, and there's less new tests being undertaken. But that, again, that could be for a multitude of reasons, and that could be why we're seeing a difference to these numbers. But it's just to make you aware there's lots of figures and facts there, should you wish to use them to look at what your services are in comparison to other areas. It's really just to put it into context for you. Next slide, please, David. So the harm principle, we've had lots of discussions at the COVID Flexible Response Team in relation to PPE and IPC and the restrictions. And we've had a really good, rip-roaring debate around the human rights of people within care services as well, while all these restrictions are in place. And the reason we've kind of put this harm principle in is just to reinforce the fact that any guidance that comes in and any sort of directive that happens or anything that's shared with you is about reducing the sort of indirect harm to people. And that's what we are picking up over the last, about the last couple of months now. We've started to really look at the IPC and the PPE per se, because rightly so, that's been the absolute focus for the past 7 or 8 months while we've been living in this COVID bubble. But what we're now seeing is that, and again, I don't like using the word indirect effects of COVID, because it is a direct effect of COVID. The restrictions are causing harm to people living in care services. And the care home staff and the care home providers, you are in an absolutely fantastic place to start to look at that and start to reverse some of that and be creative in how you do it. So again, like I was saying, the last 7 or 8 months we've been focusing on IPC and PPE, but now the inspectors, we've run a similar session to this with our inspectors, and we're starting to showcase some of the harm that has happened to people living in care services due to the restrictions. So they might have never had a case, they might have not been infected with COVID, but what we're now finding is that whether obviously if a service has had COVID within it, that was bad enough. But now what we're finding is, even though there's been no cases of COVID in services, we're now seeing a real change in the health and well-being of the older person that's living in the care service. So I think the challenge I'm putting to you today is we're now facing, how do we balance the long-term effects of the restrictions of COVID and the quality of life while trying to manage a reduction of the COVID transmission. So again, it's trying to get our head round, we have to obviously maintain good infection prevention and control practice, and we have to manage that within the restrictions that the government, against all the protection levels that are there. But we also need to start balancing that against the quality of life of people who are using services. And I'll cover that in a bit more detail, and hopefully then you'll see what we're picking up from an inspection point of view and what families are actually picking up as well due to the COVID restrictions. Next slide, please, David. So this is what we've picked up. We've been looking during our inspection activity. Obviously key question 7 covers obviously IPC and PP, but we're also looking at the effects of on people living in care services. So we've had the COVID restrictions such as essential visitings. We've had the visiting criteria. We've had the restrictions that have obviously put people in isolation, just being admitted from the community for 14 days. We've also had the 28 days that, you know, the local health protection teams can now put in place if there's a COVID case within your care home. But what we're actually picking up now, there's been a rapid decline generally in people's health and well-being over this period. And Craig touched on some of them a bit earlier, and it's around weight loss. We've also noticed the reduced mobility of people, which then results in, you know, you've got muscle wastage, which can then lead to pressure ulcers if you're not mobilising as much as you would. We're also picking up, you know, obviously in normal circumstances, between March and September is when most people across the UK will pick up their vitamin D intake, which helps with the calcium absorption and the sort of your phosphates to help your bones to remain strong. And if you think about it, care homes and older people in general, even whether you're in your own home or whether you're in a care home, have not been getting out, so they've not had the same exposure to the sun for these kind of effects to take place. So as well as the physical aspects of what vitamin D for your body, you've also got the sort of effects it has on your mood and generally speaking, what our inspectors are picking up and what families are picking up is that people living in care homes, you know, their moods are a bit flatter because they're not getting to see their family, which can then lead to sometimes, you know, really deep depression. There's also been an increase in confusion because one day is leading very much to the next, and that they're not getting that sort of outside contact apart from obviously the care staff going in and out, but the actual keeping in contact with their family has led, you know, to families reporting that they're seeing a wee change in a lot of this sort of cognition and their mental health. We're also picking up, you know, the reduced sort of professional visits is having a knock-on effect. So you've got issues being raised around eating and drinking and swallowing, and obviously if you're not mobilising as much and you're maybe not taking in enough good nutrition, then you're having effects in your whole wider body systems, including your bowel and your bladder. So again, like what we're saying, for the past 7 months it has been really focused on transmission-based activity or reducing transmission, but now these are the kind of key things that we're picking up on as we're going through our inspection process. And to really put it into context, again, the Scottish Government and the UK Government are taking this so seriously that they've invested loads of money in research to try and, you know, think of ways of how this can be reversed. And that there's been programmes run by IRIS, and there's also one being run by UWS. Again, so it's around personal care and the personal effects of the COVID and COVID restrictions over the past 7 months. If my memory serves me right, I think it's about 1.2 million it's been spent on that, and hopefully it may shed some other insights over the coming months. Next slide, please, David. This is an extract from a survey that was done by relatives, and some of you may have seen this already. But I found this quite interesting when you look at, you know, what families are experiencing, you know, around. They asked the question: does your family member get to go outside, out with your visits? And about 80%, like 54%, definitely said no, and there was another 20-odd% that said they weren't sure. So you're looking at, you know, anything about 3/4 to 80%, 75 to 80% of families have the perception that their family members have not seen outside, other than if they were up to visit at that time, or and again, what they've said is that they've noticed a big decline in the person that they were coming up to visit. So there could be correlation there. Obviously, what we're talking about earlier, the effects of, you know, lack of vitamin D or the restrictions generally on the person is having that whole person effect on them, that negative effect. And if you think about it, like we were talking about the vitamin D side of things, if you're not being able to go out, you know, that will lead to other issues in the longer term. So that I just thought that would be quite useful to show. It's a really good report. It's a very hard report to read because when you see the next slide where the comments that came from family, what they're seeing is based on how their family member presents comes as quite as a shock to them, because if you think about it, they've not really had access to their family members for quite a wee while, whereas before, if they were up visiting regularly, any deterioration, you know, it's a gradual thing, and it's expected, you know, whether rightly or wrongly, you know, people do change over time, but because they're seeing a relative more frequently before, then that sort of change is much more gradual, and you know, they're having a chat with the staff members all the time and how their family's doing. But to go from this having a, you know, regular visits to having nothing, and then all of a sudden they go up and see their family member, it is a shock to them to see the difference in the 7 or 8 months. Whereas before they'd have been sort of no drip fed it, but they would have been able to discuss things more openly with the staff, and obviously see their family member change over time rather than this big bang. Next slide, please, David. That is some of the comments from the report, and I'll give you a wee minute to read it while I'm chatting, but it's basically, like we were talking earlier, they've noticed a big decline in mental health, they've noticed a lot of weight loss. You know, there was other comments in it, like the family member feeling abandoned by, you know, their relatives. One lady thought, you know, it feels like I'm in jail. So it is around, you know, that whole gambit of trying to balance the risk of COVID versus the quality of life of people living in care services. And as a caring spectrum member of staff, we absolutely take on board how difficult this is. You know, with all the restrictions that are in place, but we really need to start thinking about now how we can start to turn around some of this and get back to, I don't want to use the word normal because there's never going to be a normal now. COVID is the new normal as we live in this bubble, but it's more around, you know, how do we support family members the best way that we can to access services. If there's a reluctance to get people indoors, how do we support people to access and get visitors outdoors, where it does, the risk is probably a wee bit less, but bearing in mind we're getting into the worst of the winter soon if we're not already there. So, and again, if you look at the stats from the family members, you know, 174 out of the 220 that gave comments, that isn't the full people that took part in the survey. You know, that is quite a lot that have noticed this kind of deterioration in mental health. And then you've got another 106 who refer to general health and wellbeing. So this is a big issue that we need to start getting our head around, both from a regulatory perspective, scrutiny and assurance, but also from a care provision as well. Next slide, please, David. Is there any questions, Stephen, or?
No, there's no questions in at the moment, Jackie. We might want to just give it a bit of time to see if anybody wants to put something in.
Okay. Everybody okay? You're awful quiet. That worries me. No, will I just carry on just now?
Yeah, we can see if there's space for questions at the end, maybe.
No problem. David, next slide, please. So what are we doing at the Care Inspectorate? Craig touched on it a wee bit earlier. What we did recognise is a COVID flexible response team. We were, if you were anything like us a wee back at the beginning, guidance was changing on a day-to-day basis, sometimes on the same day. So as a team, we were fortunate enough to have this wide sort of multidisciplinary approach, and the people that were on the team all looked at different websites because everybody was putting things out, and we had to trawl through them and try and make a bit of sense of them and make them real. So we started off a compendium which is now outward facing, now that the guidance and the flow of guidance has calmed down a wee bit. And like Craig says, in order to try and respond to some of the direct issues with COVID, but also the sort of mental health and the well-being of people, we've actually collated most of the guidance that we're aware of that would be useful across all the different sort of cradle to grave. So we've got things in there for ELCs, we've got things in there for adult services, and obviously care homes for older people and everything in between. And I do recommend you to go and have a look at that. It's like a one-stop shop for you, where everything that you know that is relevant to providing care within the social care sector can be found. You'll also see a link there to the antimicrobial resistance group guidance, and although that is primarily geared towards health, it's a really good useful link because there's really good principles in there as well. So the two of them together sit well together, and you'll see things in the HPS or the antimicrobial resistance group guidance. It's reflected in our guidance, our compendium, and vice versa. So again, depending how your brain works, you should be able to find most things that you will need to help people live better during this really, really strange time. Next slide, please, David. And that is just an example there of some of the way the guidance looks. So you'll find everything on there. Like I said, and we've got the posters, the links to all the different various guidance that will help you keep people well while they're living in the care homes. Like Craig was saying, we do try and keep it up to date. We check it, and we're currently in the process of removing older dated information. We don't throw the baby out with the bathwater. We actually have a look at it to see what's still relevant. And you'll find things on there from the Scottish Learning Disability Consortium. You'll find things on there from the Autistic Society, as well as older people. Obviously, we're talking about care homes for older people today, but at the end of the day, there's all the links to all the guidance that you will need. So again, like I was saying, it's a really good one-stop shop. And like Craig was saying earlier as well, if you've not had an outbreak, and you might have read this guidance a way back at the beginning, please go in and have a wee look, because the guidance has definitely moved on a lot, and it's a really good place to stop off and just ask your staff, pick one out and go over it with your staff in order to keep you prepared for things that may be coming in the future. Because although we're living in the COVID bubble at the minute, we cannot forget that there's other bugs out there as well. We're getting into the norovirus season, the flu season. So it'll be really difficult over time, I think. I mean, obviously you go for your weekly testing, but generally speaking, people will be starting to present symptoms that are very similar to COVID. So again, you'll need to use the guidance as a one-stop shop, but also there's lots of stuff in there that will help you as you go forward. Next slide, please, David. So like we were talking about earlier was the sort of the view or the government's position around, getting people back to feeling better, being a bit well over the winter. And one of the key things that will help with that is access to family members. And again, I don't think for a minute this is easy, because it's not. And again, you'll have all your protection levels will be giving you different advice of what you can and cannot do, depending on what's happening within your local community, as well as with what's happening in your care home itself. But what we're asking is what can you do to make say, for instance, if you're reluctant or you're hesitant to really open up more to visiting just generally. I mean, obviously you've got your essential visits and you've got your designated visits. It's maybe looking at your outdoor space to see how you can make that a bit more pleasurable to allow visiting to take place. And I know some care homes, what they've tried to do is theme it a wee bit and get creative with their garden space. And some have involved local tradesmen to build them. And the only way to describe this is indoor-outdoor spaces. So, and I'll show you some pictures in a minute of what I mean. But generally speaking, I know care home managers are really, really good at linking in with their communities and getting local tradesmen and local people involved. And I know from the information I have that there has been tradesmen involved in some care homes where they have used patio doors to allow access from the outside for visitors, where they've built these sort of visiting pods from floor to ceiling, so there is different airflow either side. So the visitors have the airflow from the patio doors, and the person who lives in the care home is obviously accessing it from the care home side, when the managers have been ventilating via just opening the window a wee crack. So the actual person who's using the service, the older person, is all wrapped up, but their family members are on the other side of a perspex screen on the other side where the patio doors are, but it is an enclosed space, so there's no gap above or below. It's two separate areas with but again, it's like an indoor space but outdoor, if that makes sense. I'll show you in a minute. And again, for us, it's around how do you involve families in developing your approach to outdoor and indoor visiting. And I'm sure you're already doing this for your designated visitors, where you need to take them through the PPE requirements, where you need to demonstrate what they need to comply with. So again, it's just reinforcing that, regardless whether it's indoor or outdoor. Be absolutely clear with family members what your expectations are. And obviously you'll have your hand washing facilities, you'll have your PPE, you know, it's the same message that goes through all of this as the facts about your 2 metre distancing, you know, avoiding enclosed spaces, no touching unnecessary surfaces, and that applies to everybody. But again, you know, there is this kind of mindset that because you get into a care service, oh, that's okay, but it's not. It's really reinforcing those messages. And again, some care services have got really creative in how they've done that. Like we're saying there, what visitors need to understand to visit safely, and we know there is challenges with that, and there is unforeseen events when you may have visitors who refuse to comply with the fax message or who refuse. Again, these are all areas of sensitivity that you'll manage on a day-to-day basis like you normally would. But sometimes it's just about explaining the reasons behind it, and that's why again COVID in context is really useful. You know, if you can, you know, speak in the language of, you know, what the transmission rate is within the area, what's happening within the care home, and about the safety aspects of it. It might make or might change behaviours for people who are planning to come and visit, especially as we're coming up to Christmas time. And again, it's about, you know, what staff have you got available to cover indoor and outdoor visits in order to support this. And no, I don't want to use the word police the PPE correctly, but it's really important that they know how to fit the bridge of the nose of the mask and things like this, so that, you know, it really does reduce the risk of transmission. We're talking then about dealing with unforeseen events, you know, really have like scenario planning with your staff so that they know how to handle, you know, when things don't always go to plan, you know, like when people refuse to wear the PPE or they refused, you know, some really good piece of advice that you've given them. It's really important that staff know how to deal with these. So again, it's about maybe creating those wee scenarios and talking them through with your staff, because they will come up, because I know they've come up and it's been raised with us here at the Care Inspectorate. And if all else fails, you've obviously got the use of technology. And again, we do recognise that, you know, care homes at the minute are absolutely amazing when it comes to encouraging the use of technology to keep the older person connected with their family. I have to say what I've struggled with over the last couple of months when we've been preparing for these sort of events is trying to find out what's actually, you know, what is in place. You know, I've found it more by default than design. And it's really important that if you're doing something that's really creative or different, I'd really appreciate that you could share it with me, because I would like to share it with everybody else on your behalf. Because we know that there is anxieties around visiting and, you know, reducing and transmission and everything to do with COVID. But if you're doing something really well, it would be great to hear it, and it would be great to share with others, because we really do into that mindset of all teach, all learn. So again, please share it with me. Send me pictures, send me ideas of what you're doing. And again, I'd like to compile these for the end of these sessions, so that we can put it out and share it with you, and you can cherry pick what you want. Now I'm going to show you here some pictures. David, next slide. And you'll love some of them and you'll hate some of them. I mean, we've been through the mill in the last 7 or 8 months. We've been everywhere from, we've had window visits, we've had drive-through visits, we've had the use of the gazebos, the sort of temporary structures. The one in the middle bottom, to me looks like a snow globe, and I wasn't really sure how I felt about it, but to be honest, it doesn't matter how I feel about things. If it works for your service and it meets the fax message, then go for it. It's the best idea. Obviously, you've got your local health protection teams if you're unsure. We've had services who've run lovely afternoon teas, you know, but they've kept to 2 metre physical distancing, but they've used their gazebos outside. And one of the other sessions we were challenged from the point of view is, oh, we're going into the really bad weather. The weather really shouldn't be a barrier. You know, if you get people wrapped up well and you're using your outdoor space well, and it's about exposure time as well, so you keep the visit short and sharp, but again, you're still promoting that connection, which I think again then leads to reducing or changing some of the negative effects of these COVID restrictions in people. The use of technology is there. The top right hand one is the visiting booth. So you can see there through the back, top right, is the patio doors. So this care home got the local tradesmen in, and they just basically built a frame around the entrance into the care home a wee bit, put the perspex up, and the visiting took place there. So again, if you look at the outdoor visiting guidance, you could get maybe, 1 or 2 people into that visiting booth that could maintain physical distance with the person that they're coming up to see on the other side. Now, it's no ideal and it's not the best, but again, it's about using what space you have very creatively. It's also about thinking through what else you can do. And like I was saying earlier, it's to basically turn around some of these negative effects of the restrictions that are having on people who are living in care homes, while at the same time keeping the facts message to the front of your mind and also focusing on reducing the transmission. The other thing I'd like to highlight here is the bottom right. The Care Inspectorate are running a Films in Care, and the resource was due to be launched, I think, this week sometime. So watch out for it, because again, it's a really good resource that you could use to hold a cinema night outside and outdoors. And the guys who are running this project are really keen to try some form of outdoor activity. So again, as we're coming into the festive period, it might be something to consider. Again, they've been building these temporary structures outside. They've been using that to have it, and again, that will depend on the size of your garden and the layout of your garden. But again, it's just all things to consider that we're floating out there with you to get us through the next few months until we see where the land lies in the new year in relation to vaccines, and whether the vaccines, are having the effect that we hope that we'll have in order to, maybe get things back to being a bit more normal. Next slide, please, David.
Time, Jackie.
No problem. So we all live in the real world, so this is about getting practical and about being outbreak ready. So what we're saying here is planning is key to minimise the risk to you and others. So again, like we were saying there, maybe have a wee think about scenarios that might come up as you're starting to get more visitors in, and get your staff to think through how they would deal with them. The HPS outbreak checklist is there for you. We're also being asked about the use of agency staff and what is required before agency staff can work in the service. So again, be clear in your mind about what it is, and because again, we're coming up to the time, where, like I said, you've got norovirus and flu coming up, and that will affect your staff just as much as anything else. Using the compendium or the one-stop shop to keep your staff updated. Make sure your PPE supplies, your business as usual routes. I'm not aware of any supply and demand issues, but the PPE side of things, it's really important that you have all these systems in place, and you just check with your supplier to make sure they're not experiencing any supply and demand issues. Look at the visiting guidance and be creative, because it's really important that we start to reverse some of the negative effects of the restrictions that are having on people and their quality of life. And you're the only people in the care home sector that can really, who are working there, that can do that. And really get your head around the protection levels, as well as how that applies to the visiting guidance. Again, refresh your memory and just have another read at it. And again, my big thing is using outdoor space a bit more creatively if you're a wee bit more hesitant to allow full-on indoor support at this time. Next slide, please, David. So the facts message, like Craig said, is the key to all of this. And as I said, if you wash your hands, kills the bug. If you keep the surfaces clean, it reduces the risk. And again, if you can think about how you can involve family and tradesmen to try and maybe open up your service a wee bit more to visit, and if you're not doing it already, you will go a long way to reverse some of the indirect and direct consequences of COVID on people's quality of life. I'm going to finish there. I'm going to hand you over to Joanne Matthews from the HIS, from Health Improvement Scotland iHub, who's really going to take you through the Essentials in Care work streams that is coming on board. So I'm going to hand you over to Joanne. Joanne, over to you.
Thank you very much, and thank you very much for the opportunity to be able to come and speak to you today. Building on the discussions that you've already heard today in relation to how do we support the delivery of safe care across all of our health and care system. If you can move to the next slide, please. Thank you. So The COVID pandemic has presented significant challenges for health and care systems, and you've heard much of that this afternoon. As Scotland now adapts and plans for this new context, creating the conditions for maintaining safety for those receiving and for those delivering care remains our guiding principle. And at a time when there's such significant and complex change, ensuring that the essentials for safe care are in place and are reliably implemented for every person within every system every time are fundamentally important to how services are planned and delivered. The concept of the essentials of safe care came about through feedback from services right across health and care about what had worked for them during the first wave of the pandemic, what would help not only to manage the ongoing pandemic, but thinking about beyond that. So what the essentials of safe care are they provide an evidence-based guidance for the safe delivery of care in all settings. This is work that brings together existing guidance and standards, many of which that you will recognise, into one single package, which can then be applied in any health or care setting. We developed it in conjunction with a range of representation from services right across the whole system and developed 4 design groups that reflected the 4 prioritised essentials areas, which are person-centred care, leadership and culture, communication and clinical and care processes. All the groups developed the package underpinned by some key principles. And these were really to ensure that it was sufficiently generic enough that it reflected the whole health and care system, that it was absolutely underpinned by a rights-based approach, that this was not something that would be mandated, therefore you would not be receiving a letter to say you will do this. This is about supporting you with embedding what we know is the evidence base and the standards for delivering safe care. And lastly, it was about building the knowledge and the guidance and applying different approaches to make that reliable. The resources that we're building are based around the practical tools that are already in existence. Over time, developing case studies about how people are applying the essentials of safe care within their service. Offering the opportunity of signposting and really helping people to consider how are they going to measure that they have this in place for every person every time. And that may require at times some improvement support. But alongside that, it will be about thinking about this within the context that people are living and breathing now, but also beyond that. The resources that are covered within the essentials are supported by what we're calling a learning system. And that brings together teams from right across health and social care to develop really clear networks where they can come together to share their experiences, learn from each other, and also build the resources of which we are then able to share more widely through webinars, websites and social media. As I said, the essentials have been developed in such a way that they should be sufficiently generic enough that they can be adapted for any of the contexts. But what we're doing at this moment in time, and actually we'll be meeting with teams tomorrow, is to think about how we're going to actually test that this package is relevant and appropriate for all of these different settings. So we're going to test them over December and January. And following that testing, it's anticipated that we will have a launch of the final package early in 2020. And the implementation of that final package will be supported by that learning system with facilitated improvement support, virtual learning sessions and those case studies being built. Now, if you are interested in finding out more about the essentials of safe care or wanting to take part in any of the testing work that we'll be undertaking, then I'm going to pop my email into the chat box I am more than happy for you to drop me a wee note, and I'll get back in contact with you shortly. So thank you again to the team for enabling me the opportunity to come and speak today.
Thanks very much, Jo. Yeah, and just to reiterate, Jo's going to put her contact details in the chat function. The early part of this work in terms of testing it in the sector, so please do get in contact with Joanne if you want to find out more about it, and you will be hearing more and more about the Essentials Occur as we move into the early part of 2021. I'm just a quick time check. It's 4 minutes to. We may not have time to go through some of the questions that have been asked in the chat function, which there has been a number of up until this point, some quite lengthy ones, and I see the team are busy trying to reply to them in the chat function. But bear in mind, we will also send out all the questions and answers to those questions with the slides in the next couple of days. So all those questions will be answered. So if we haven't got to it today, we will get to it. Next slide, please. Just to signpost you, we talked about a number of resources that we've developed in terms of the FAQs that you'll find in our COVID landing page on the Current Spectre website, which is very useful information. Some questions there that people have asked that some of you guys have noticed have asked as well. So the answers are there to review, and they're nice little categories as well in terms of service type. And also the compendium, which Jackie and Craig and the COVID team are responsible for building and keeping up to date, which really is a one-stop shop for all the guidance for the social care sector, and it saves all that of the hassle and potential confusion of going to multiple different places to try and find the most relevant and up-to-date guidance. But this resource page is also just another quick hyperlink to some of the things that have been standing out as the most visited pages on that site. So you can use this as well. Whenever you get the slides, you can follow the links quite simply there too. Next slide, please. So I just want to, before I finish up, just remind you about the level 2 webinars that are planned for care homes on the 16th of December from 1 until 2:30. I would urge you to put that date in your diary just now and book it off. We really think this is going to add value, and like I said earlier, this is around the self-evaluation that we have, the self-evaluation tool pack that we have devised that's based around key question 7 in our quality frameworks. So it's to introduce it to you and to talk you through its use and the flexibility of use with it. In particular, it's a tool that obviously reflects our inspection and quality framework criteria, which is reflective of the health and social care standards, but it's for services to really just undertake this a process, and you can do a really comprehensive process, or you can break it down into individual parts to be as flexible as it can be for services, recognizing the pressure that people are under out there just now. And what it does is it builds for the future as well. So this is around the COVID context, this self-evaluation, but what it does is it helps services think about self-evaluation around all of the quality frameworks, all the key questions that are there, so services can think about using that to self-evaluate and self-reflect about their services moving forward. So please do book that in. You'll get an invite direct to your inbox for this webinar over the next day or two as well. And hopefully we can see you there, and we really do think that will add some value. And that will be about an hour and a half. Well, it is an hour and a half, but we're setting aside quite a bit of time for Q&A around that. It probably will be a Teams live event again, so most of it will be around the chat function like we're using today, just due sheer numbers of people that are coming along to these things, which is a good reflection of you know, the need out there for it. And Stephen is about to pop into the chat function a self-evaluation. If it's a 2-minute job, and not self-evaluation, sorry, evaluation of this this webinar, just to let us know how you felt it went, whether we achieved our goals in terms of signposting people, and it's a 5 quick questions just to let us know. And if you can't do it today, we'll send that out also with the slides and the information about the level 2 webinars. So please complete that and let us know. We'll leave this chat function open for the next 15 minutes minutes or so just to let people maybe read through some of the answers, maybe click on some of the links and stuff put in there. So please do that, and hopefully we'll see you guys on the 16th of December. So that just leaves me to say thank you very much for all our speakers, everybody in the Current Inspectorate who's put all the work into delivering this today and all and the preparation for that. And a big thank you to you guys for taking the time out of your very busy days to come along, and hopefully we've achieved our goals. So it just leaves me to say have an enjoyable rest of the day and stay safe. Thank you very much.